coming to our topic now, the first thing I want to tell you here is that in this I am going to explain you what do you mean by the isolation practices. In fact, the first standard precautions, and then what are the types of isolations we have in the hospital, and how are the transmission based precautions are important, and what challenges as an infection preventionist we are going to face in the hospital. Say in the Indian scenario, it is a low economic resources are there. We do not have enough resources in our hospitals to supply and give the things immediately whenever it is required. For example, if the government hospital who is catering more than 1,000 patients in a day, where so many patient comes with a open case of tuberculosis or other types of infectious diseases, we do not have a proper personal protective equipment available. Not only in the government hospitals, even in the corporate hospitals, some of the corporate hospitals they could not able to cope up, they could not able to supply the personal protective equipments in the hospital. So, this is what the challenges, what other challenges we are going to face during this implementation of infection prevention and control practices we are going to discuss. Coming to this exit competency, once we finish this, at the end of the module you can able to define the standard precautions. You could able to define what it means by standard precaution, and also you understand the chain of infections and also the modes of transmission of infection. See, this is the thing, I am not contagious, let me guess it is a contagious. Like if the patient comes to the hospital, it has been welcomed by a multi-drug resistance in the hospital. Though the patient has his own illness and it comes with the own organisms in the hospital, but at the same time there are multi-drug resistance who are ready to welcome the patients and attack the patients. So, the isolation practices, you have to keep calm and wear your personal protective equipment. The personal protective equipment terminology is very important. To the viewers, I would like to tell you that whenever we come across this terminology, personal protective equipment, that means the basic requirement of the infection prevention and control. If you see, before we go into the details what all are included in the personal protective equipment, the definition of isolation precautions, it is a special precautionary measures, practices and procedures used in the care of patients infected or suspected with contagious or communicable diseases. So, in short, if you ask me, the standard precautions are nothing but what precautions are you going to take to prevent yourself first from getting infected with the patient's illness, and at the same time how are you going to protect the patient from your commensals on your body. Coming to I think you are aware of the terminologies of the commensals. Commensals are those organisms which, like the skin commensals, are those which are stays on the skin and symbiotically with the body without causing any damage. Similarly, our body harbors lot of organisms not only in the skin, but also in the gastrointestinal tract, in the respiratory tract and other places. So, our body is composed of both the cells and the microorganisms. So, when I tell the standard precautions, that means the precautions which we are going to protect ourselves from the illnesses the patient is suffering from. Like example, if the patient is an open case of tuberculosis and if you are going and treat the patient, before going there and the patient is coughing, it is an open case of tuberculosis, that means that the patient has an acid-fast bacilli in the sputum and there are chances that the airborne, it comes out through droplets and airborne, the chances of infections will be high to the healthcare providers. Healthcare providers here includes not only the doctors, but also the nursing staff and also the housekeeping staff and other staff who is coming in contact with the patient. So, what are you going to do? How are you going to protect the patient from the hospital pathogens and how are you going to protect yourself from the patient's organism is basically an idea about the standard precautions. If you see the 2007 guidelines for isolation practices which preventing the transmission of infectious agents in healthcare setting, it is a very good link where you can see what are the guidelines which we need to follow to avoid the transmission of infectious agents. There are two types of classifications here. One is a standard precaution, another is a transmission based precaution which we are going to discuss in other module. When I tell it is a standard precautions, that means mainly involving the personal protective equipments and some of the other elements in infection control. Transmission based precautions are those where we are going to, what precautions we are going to take for the patients who are suffering from the infectious diseases which can get transferred through droplet and airborne. See, these are the isolation precautions. The first is a standard precaution, second is a transmission based precautions and isolation precautions. If you ask me, this is more like a mathematics. If you understand the basics of infection control and the basics of the microorganism, especially the epidemiology, how it get transferred from patient to an inanimate object and to another patient or the healthcare providers, then you will have a very good idea about which precautions has to be followed in case of any infections. So, many times we see in the hospital, if the patient has some problem with oozing pus, with suppose an MRSA in that, where it is a multi-drug resistant organisms which causes very rampant infections of skin and soft tissue, we see the patient has been isolated. Actually, if you ask me, there is no need for isolation for this type of cases. You need to follow just contact precautions. If the patient is infected with HIV or hepatitis B or hepatitis C, as long as the respiratory element is not involved, if you take the proper contact precautions, that is more than enough.